So for today, we'll have two parts of this discussion. We'll have the electrical stimulation for wound healing edema, and later on, we'll have the ES for the muscle, the nervated muscle contraction. Okay. So first off, electrical currents for tissue healing. ES can also contribute to a rehabilitation program by promoting tissue healing. Okay, so maalala nyo, during our intro to electrical currents in our midterms, isa to sa mga features kung saan the electrical stimulation can contribute. So, tissue healing may be promoted directly by applying the current to a wound, or may be promoted indirectly by controlling edema or promoting transdermal delivery of medication. Okay? We have what we call your galvanotaxis, wherein ES promotes tissue healing primarily by ionic effects, attracting or repelling charged entities. So, para siyang iontophoresis in a way. Okay? Para siyang iontophoresis. Wound healing phases. Medyo review lang natin ng konti. First off, we have the inflammatory phase. Second would be proliferative phase. And then the third would be the maturation phase. Okay? In your proliferative phase, this is where masasabi natin nasa second stage of wound healing na siya if there is a reepithelialization that is happening. When we say reepithelialization, it occurs at the surface of the wound, while deep within the wound, fibroblasts are migrating and proliferating. Okay? Also in here, nagkakaroon tayo ng collagen deposition and wound contraction. So, ibig sabihin, konti-konti na siyang nag-contract, nagko-close yung wound. Okay? With their inflammatory phase kasi, ito yung part before that, kung saan there is swelling, okay? Andun yung ating 5 cardinal signs. Okay? Kung saan meron kang functional limitation, meron kang redness, meron ka ring swelling, okay? Meron ka ring pain, of course, painful siya, and lastly would be, lang natin, ayan, heat, mainit yung area. Kasi pulled masyado yung blood within the area. Okay? Ayan. Kasi currently, they're trying to fight off whatever that might cause infection in that wound. In that wound. Okay? So, going back to the proliferative phase, yung fibroblasts na sinasabi natin dito na nagpa-migrate and nagpa-proliferate deep within the wound. These are the cells that synthesize scar tissue, which is composed of collagen and protein polysaccharides. Okay. Maturation phase, this is the third wound healing, third phase of wound healing, and kung saan, ito yung pinakamahaba. Maalala ninyo. Ito yung pinakamahaba. A wound is considered closed at the time epithelium covers the skin surface. Reduction of number of fibroblasts, decreased vascularity due to decreased metabolic demand, okay, and remodeling of collagen. Sa maturation phase, ito na yung it starts when the wound closes, okay? And dito makita nyo meron ng it could either be a scar formation or scar formation itself. Okay? So, yan dalawang yan. So, on the surface, okay na siya. Pero underneath, it could still be undergoing some repairs. Okay? But, of course, there will be the reduction of the number of the fibroblasts. Okay? General factors associated with inadequate healing and repair responses. Okay? So, ano yung mga factors that could lead na parang there is a slow repair, okay, or slow healing of the wound. Okay, so we have 3. Inability to form a blood clot or mount an adequate inflammatory reaction. Okay. So, we need the blood clot, kasi siya yung papatigil ng bleeding inside, okay, and of course outside. inability to produce new cells, or scar components in adequate quantity or quality. Okay, so syempre, part of the healing process is regeneration. Okay, so we need new cells. So in here, no, kailangan adequate daw yung quantity or quality. So usually nagkaka-problem tayo dito pagka we have large wounds. Kaya doon mas kinakailangan na talaga siya ng intervention. Inability to organize the scar into an appropriate functional or cosmetic unit. Okay? Ito yung, kumbaga, nagkakaroon tayo ng different types of scar like your hypertrophic and your keloid scar. Okay? Ayan. So, I hope naalala niyo pa, no, yung difference ng hypertrophic and your keloid scar. When we say hypertrophic scar, it means that it is within the borders of the wound. Okay, pero pag keloid, it goes beyond the border of the wound. Okay? And, syempre, mas pangit yung keloid as much as possible. Ayaw natin siya. Okay, so, ano-ano, saan natin magagamit yung ES for the treatment of what kind of wound healing, no? So, pwede daw siya for chronic stage 3 or stage 4 pressure ulcers, okay, arterial ulcers, diabetic ulcers, and venous ulcers. So, these are the kind of wound talaga na talagang mahirap yung kumbaga matagal ang healing nila, and most commonly they are associated with delays, infections, na nagpapatagal lalo ng healing. Okay, so, the ES could help fasten the process. So, in the most recent systematic review, published in 2011, healing of various types of wounds can be facilitated by ES daw. Okay? In the animal studies, no, the ES have demonstrated an increase in DNA, protein, ATP, increased intracellular calcium, and VEGF production, all of which are very essential in wound healing. Okay, so if the ES could increase that, then we are promoting a fast regeneration of these new cells. Okay, in human studies naman, no, there is increased microcirculation and tissue perfusion and significantly reduced wound area. ES was most effective for accelerating the healing of pressure ulcer and increased tissue oxygenation and reduce discomfort. Yan. So, effective pala ang inyong ES, no, to promote wound healing. So, yung kanina, no, yung nabanggit dito ng mga DNA, protein, ATP, okay, balikan natin siya ng konti. No? So, bakit sila kailangan in wound healing? DNA is considered to be the auto-reproducing component of chromosomes and the repository of hereditary characteristics. Of course, ito yung kumbaga, ito yung pinaka-identity natin. So, kailangan in regeneration, kailangan talaga siya. Protein, this is 3/4 of the dry weight of most cell matter. So, kailangan din talaga siya. Especially if you have a wound, meron at meron talagang kailangan na protein dyan. Okay? Kasi we are mostly made up of protein itself. ATP can provide 3 strong muscle contraction. Calcium initiates cellular activation and vascular endothelial growth factor. This for your microcirculation. Okay, microcirculation. So the ES aids in wound healing, particularly when applied in conjunction with standard wound care. Okay, standard wound care. So, how electrical stimulation facilitates wound healing? Paano nga ba? Okay. Your electrical stimulation, it attracts appropriate cell types to the area, activating the cells by altering cell membrane function, reducing the edema, okay, increasing protein synthesis and cell migration, enhancing antimicrobial activity, no? Ang pinaka-cause talaga ng wound for it to heal ng mabilis would be if there is a formation of infection. It greatly slows the healing kapag nagkaroon ng infection doon sa wound. So, as much as possible, sana wala. That's why, ang ina-educate sa atin pag may wound, diba, is to disinfect it right away. Na pag nasugat ka, kailangan mo daw siya hugasan in running water, para hindi ma-infect yung wound. That's first of all, kumbaga yan ang pinakaunang concern natin. And the ES somehow helps that, by enhancing antimicrobial activity. It promotes also circulation and improving tissue oxygenation. So, very important kasi yung oxygen in accelerating the wound healing. Okay? Kaya nga, kapag merong wound, instead of covering it with a gauze, they are promoting na dapat nasa open air siya. Okay? Pero syempre, it depends on case-to-case basis. Meron talagang wounds na kailangan i-close para hindi siya ma-infect. Okay? Especially with ulcers. When we say ulcers, talagang meron siyang cavity underneath. So, instead of pupunuin nila yon ng gauze, yung loob, okay, they would just cover it. Okay, pero sa loob, meron siyang space na hinahayaan lang. Right? Ganon. Specific cells. Okay? Ito yung mga specific cells that act on wound healing. Okay? Neutrophils. Okay, this helps mature the white blood cells. Macrophages, phagocytic cells in nature. Neutrophils, these are the mature white blood cells. Macrophages, phagocytic cells in nature. Lymphocytes, this is for your immune process. And then fibroblasts, this is for the formation of your new scar tissue. So all of them can be attracted to an injured healing area by an electrical charge. So, itong mga to, specific cells na to, we need them in order to accelerate the wound healing. Okay? So, the ES can trigger the opening calcium channels in the fibroblast cell membrane. The open channels allow calcium to flow into the cells, increasing intracellular calcium levels. It induces additional insulin receptors on the cell surface, So, para sa itong additional insulin receptors, one of the factors kasi, kaya matagal yung wound healing would be, yun nga, mataas yung blood glucose. So, kailangan natin ng additional insulin receptors so that this insulin, so that itong mga insulin receptors, they can let the glucose inside the cell. Especially yung glucose, pagkain din siya mismo ng cell kasi. Okay? So, kung mapapansin ninyo na in diabetes mellitus, they have a problem with absorbing the glucose. That's why one of the sign and symptom of your diabetes mellitus is that it takes time for them to heal yung kanilang wound. Okay? Insulin can bind to the exposed receptors, stimulating the fibroblasts to synthesize collagen and DNA. So this can happen with HVPC with a peak of 60 to 90 volts. Okay, so yan yung gagamitin kasi natin, your HVPC. Okay. So sabi dito, fibroblast and collagen are essential for the proliferation phase of the tissue healing. So sa mga girls, talagang pag nabanggit yung collagen, maisip agad natin skincare, Kasi kung makikita ninyo, even sa skincare, may mga sinasabi sila na eto, collagen. Okay? So that is applying science in here, kapag nagsi-skincare kayo. Kahit ako, ito yung mga binibili ko, yung merong yung collagen enhancement, because it's good for healing of the tissue and also healing and kumbaga magpapaganda talaga siya ng skin. Okay, so especially pagka sa wound healing itself. Okay, so let's talk about the monophasic currents. Okay, with a microampere level direct current and HVPC. They have been shown to kill bacteria, not in alternating current. Okay, not in alternating current. Higher duration and voltage should be employed to effectively manage bacteria. Okay, ayan daw. So, hindi alternating current kapag wound healing. No, it should be direct current. Okay, direct current. So, both your microampere level direct current and the HVPC have shown to kill bacteria. Okay, so the ES facilitates healing by increasing circulation during or after the electrical stimulation. Okay, so ES might accelerate wound healing as a consequence of, so bakit niya na-accelerate yung wound healing? So, this is a consequence of activation or attraction of inflammatory cells, attraction of connective tissue cells, enhanced cell replication, enhanced cell biosynthesis, and inhibition of infectious microorganism. Ito yung pinaka-importante sa lahat. No? Inhibition of infectious microorganism. So, we have specific electrode polarity. So, parang katulad lang din siya ng iontophoresis ninyo. Pero ito, galvanotaxis yung term natin. Because in here, we're not applying the drug itself, but we are trying to attract the necessary cells for the given time period of the wound healing. Okay? So, we make use of negative, yung negative electrode, no? It attracts activated neutrophils present in inflamed or infected wound. So, if it's in inflammatory phase or infected yung wound, we make use of the negative electrode. Okay? It also attracts lymphocytes, platelets, mast cells, keratinocytes, fibroblasts. So, the goal of using the negative electrode is to promote healing of inflamed or infected wounds. On the other hand, si positive electrode naman, it attracts inactive neutrophils, macrophages, epidermal cells, and should be used if necrosis without inflammation is present. And when the wound is in the proliferative stage of healing. So, ibig sabihin, at the earlier stage ng inyong wound healing, we make use of negative electrode primarily. And then, later on, no, as the wound contracts, the wound starts to close, we will make use of the positive electrode. So, paki-memorize po itong mga na-attract ng bawat electrode. No? So, matatanong kasi yan. Right? Next. What are the contraindications? No? Of course, demand pacemaker or unstable arrhythmias. When electrical stimulation is delivered with a stimulation unit. Bawal din po over the carotid sinus, venous or patients with a present thrombophlebitis, venous or arterial thrombosis, okay, pelvis, abdomen, trunk, and low back during pregnancy. Okay, so those are your contraindications for ES for tissue healing. Precautions. Okay? Ito naman yung ating relative contraindication. It means from case-to-case basis, pwedeng i-apply siya, pwede din namang hindi i-apply. Okay? Cardiac disease, impaired mentation or sensation, malignant tumor. So, ibig sabihin, pag masyadong malapit dun sa pinaka-area ng tumor, we might not use ES. Skin irritation or open wounds. No, with this precaution, no, if you are having skin irritation, okay, if you're having skin irritation with the application of ES, you might have to discontinue applying the ES. Okay. Okay. So, applying near wounds, no, these are our precautions, no? It is common for patients not to have intact sensation in these areas, no? Of course, kasi diba, yung mga receptors nila, no, medyo na, it was also injured. Okay, so you would really anticipate that the intact sensations is not that good near the wound. Okay, so with this one, as precautionary, you should lower the amounts of stimulation because we wouldn't want burn cases. No, common pa naman siya sa direct current. Okay, sa direct current, meron tayong mga burn cases, no? Infection control. If electrodes are placed in wounds, okay, a new electrode should be used each time. Okay, so dapat bag. Self-adhesive electrodes should be single patient use only, and chronic wound should be kept clean. So, protective covers for electrical stimulation devices and leads to minimize transmission of communicable diseases such as your MRSA. Okay? Ayan. So, ito yung mga communicable diseases na yan. We would want to prevent, no, from acquiring these kasi sila yung mga hirap gamutin. Aside from the infection itself, no, cases such as your MRSA, ito yung kumbaga you are not responding to antibiotic. Okay? So, medyo mahirap yan kasi they are highly contagious. Okay? Yung mga ganyang infection. No? And it could be fatal if not addressed, if it was not addressed properly. Okay? Parameters for electrical stimulation to promote wound healing. Okay? The treatment electrodes may be placed in or around the wound, and one treatment electrode is used when treatment electrode is placed directly in the wound. Okay, so isang treatment electrode lang daw ang kailangan. 2 or more treatment electrodes may be used when stimulation is applied to the area around the wound. So, if it's directly in the wound, no, it's directly doon sa mismong wound, isang treatment electrode lang daw ang gagamitin. But if it's around the wound, dalawa or madami. So, pwedeng 4. It depends on how large the wound is. Okay. Next. So, if directly over the wound, the electrode should be made to fit the wound. Okay, so the type of electrode is made by placing saline soaked gauze directly in the wound and then covering this with a single-use disposable electrode, multi-use carbon rubber electrode, or a layer of heavy-duty aluminum. So when we apply, no, directly over the wound, hindi talagang yung electrode mismo. Okay, kailangan saline soaked gauze siya. So gauze, tapos bubuhusan niya ng saline. Okay, meron tayong mga mabibiling saline sa mercury drug. Okay, yan. So pwedeng yun yung gamitin ninyo. Alright, so yung gauze na yun yung ipang tatapal nyo in the wound. Okay? And then, saka niya ilalagay yung electrode. Alright? If around the wound, no, self-adhesive electrodes are recommended. Okay? One large dispersive electrode of opposite polarity to the treatment electrode should be placed on intact skin close to the wound site. No? Dapat several inches away daw. Okay? Several inches away. One large dispersive electrode. Remember, no, yung ating electrodes, they are in pairs, no? Although we are using one electrode, if we are applying directly over the wound, we need another electrode to close the circuit. Hindi po pwedeng talagang iisa lang talaga. No? So, kailangan natin ng magko-close ng circuit. So, that's why meron tayong one large dispersive electrode of opposite polarity but should be placed several inches away from the wound site. Okay? Ayan siya. Okay, continuation of the parameters. Polarity of electrode, this is according to the type of cells required. So, we make use of the negative electrode if yung mga cells na kailangan natin or the goal of our intervention is to heal yung or address the inflammation, or we would want to address the infection. So, yan nakalagay na dito. Negative polarity, early inflammatory stage. Usually, first 3 to 7 days of treatment. And then, you would change it to positive afterwards. Pero, ito case-to-case basis, no? 3 days after wound bed becomes free of necrotic tissue and drainage becomes serosanguinous, use of positive polarity. So, yung parang magiging basehan natin kung kailan tayo magpapalit from negative into your positive polarity. Okay? 3 days daw. After ng wound bed becomes free of necrotic tissue. Okay? Positive polarity. Now, this is at the later part of the wound healing process. No? This is to facilitate the epithelial cell migration. So, the polarity, consistent with many recommendations. Again, negative polarity, initial treatment when wound shows signs of inflammation. Positive polarity when the wound shows no signs of inflammation or when healing plateaus. Okay? This is the specific recommended parameter settings for ES for tissue healing. No? So, ang waveform na gamit natin dito is your high voltage pulsed current. Okay? And then, ayan. No? Same lang sila, no, ng lahat ng parameter except for the polarity. Doon nagkakaiba. Polarity. So, if you would want to improve inflammatory phase and infected wound, no, you make use of negative polarity. Tapos, ang pulse frequency to be used is 60 to 125 pulse per second or hertz. And then the pulse duration is usually preset at 42 microseconds. Sorry, micro yan, ha? Microseconds. Ba't ganyan yung spelling? Yan, kinapi-paste ko lang kasi kaya na-unit dito. Anyway, the ES delivered continuously to attract charged particles. So, meaning, this is continuous. No? Continuous lang. Kasi, especially if we are using direct current, alright? Direct current kasi ito. If you are using direct current, kailangan continuous siya. Walang off time. No? Pero, you might question, ma'am, bakit po pulsed current yung tawag kung wala siyang off time? No? I'm quite not sure with this, pero yun kasi yung waveform na required sa kanya. HVPC. Pero, not to be confused, ang ifa-follow nyo would be the parameter given. No? So, huwag nyo na masyado isipin tong sa HVPC. Ang importante, no, is that the frequency and duration. And then, the duty cycle, so wala siyang off time. Amplitude to comfortable tingling sensation. So, makakaramdam sila ng tingling sensation here. And the treatment time is 45 to 60 minutes. Okay. Same goes with your positive electrode. Unfortunately, no, hindi natin siya kayang gawin sa machines ninyo. Naalala ko na, no, with your HVPC kasi, no, we are able to indicate yung polarity. No? Pwede natin ma-indicate yung polarity ng mismong electrode. Doon kasi sa machines na meron tayo, no, I have inquired, no, hindi kasi siya specific. Okay, walang specific na eto negative to, tas eto positive to. Alright? Wala daw ganun. Okay. Now with edema, no, edema is a normal response following tissue trauma. So, most of the time, this is normal. Okay, however, no, at some cases na hindi siya normal, no, kailangan natin siyang i-address. Okay? Edema, no, nagkakaroon tayo ng edema if there is potential systemic disorder and there is an accumulation of fluid that produces the swelling. It can have protective effects, okay, such as, no, splinting the injured area. Okay? Component of the first stage of tissue healing is inflammation. No? So talagang your inflammation is healthy. It's normal. Okay? So, kung kailan lang natin siya kailangan ng intervention is that when it's taking too much time. Okay? Dun siya kailangan na i-address. Okay, so edema, no, this is associated with increased pain, decreased function, and prolonged recovery. Okay, yan. So edema due to inflammation. Okay, edema secondary to inflammatory response. This is red and warm. Okay, with electrical stimulation during inflammatory response, no, it retards the formation of edema. Okay, with the use of negative HVPC, roughly 50% after acute injury. Roughly 50% after acute injury, the effect of your negative HVPC is similar with ibuprofen and cold water immersion. So, ganun siya ka-effective. Okay? And in retarding the formation of edema, you don't do this with positive HVPC and biphasic current, no? Or your alternating current. Hindi pwede. Kailangan direct current and kailangan negative HVPC. So HVPC has shown to be effective due to the following mechanisms. No? Negative charged repels negative charged serum proteins, wherein it blocks their movement out of the blood vessels. Okay, so kaya yun, parang katulad din siya sa iontophoresis, no? Yung principle, like repel like. So therefore, ito sa kanila, ganun din yung ginagawa. No? So, in negative HVPC, you repel these negatively charged serum proteins, whereas sila talaga yung nagpapalala ng edema. Okay, current decreases blood flow by reducing microvessel diameter. Okay, reduction in pore size in microvessel walls and preventing large plasma protein from leaking through those pores. No? So, ito talaga yon. Alright? Kaya tayo nagkakaroon ng swelling, no? Because there is an increased blood flow. No? But, you have to remember, no? When we do an intervention, ibig sabihin, it's beyond the normal flow na niya. Okay, it means yung gusto nating increased blood flow in the area para gagaling siya agad is taking too much time. So by this time we want to control that. So we would want to decrease the blood flow by reducing the microvessel diameter and of course reduce the pore size, no, para hindi magli-leak yung ating plasma protein from the blood vessels. No, sila kasi yung pinaka nagko-cause ng swelling. Okay. And of course, no, acceleration of functional activities. Edema due to lack of muscle contraction, no? So dahil wala kang muscle contraction, no, nagkakaroon ka ng edema formation, no? So yan yung tinatawag nating yung sa muscles, no, especially sa lower limbs, mapapansin nyo with elderly and yung sa mga hindi masyado nakakalakad natin na mga patients, no, or sa mga no-observe nyo na mga kamag-anak, no, yung mga hindi masyado nakapaglakad na, they have edema to lower limb, especially the lower leg and the foot, and their feet. Okay, nagkakaroon ng edema formation. This is because they lack muscle contraction. Yung muscle contraction kasi na yun, it somehow, no, it helps na yung plasma protein hindi siya mag-leak. Okay, hindi siya mag-leak through. Para babalik siya dun talaga sa blood vessel. No? It has something to do with the pressure, no? With your hydrostatic and osmotic pressure. So with motor level electrical stimulation, no? With limb elevation, you increase the popliteal blood flow, okay? Therefore, addressing the edema. So, hindi siya po pwede with NMES sensory level. Kailangan motor level siya. Okay? Kasi kailangan, if you are having edema due to lack of muscle contraction, then we definitely would have to contract those muscles. Okay? If ang pinaka-cause niya talaga ng edema is lack of muscle contraction. This can also be done with edema secondary to lower X surgery or thromboembolism. Ito after na ma-address ng thromboembolism. Pero medyo high ang precaution natin dyan kasi po pwedeng meron pa ring natitira doon sa popliteal area ng patient. So, kailangan mag-exercise kayo ng extra precautionary measures. And you would have to inform the physician of the patient if you are going to apply ES to address yung edema sa area na to. Okay? So, with their consent, saka nyo po pwedeng gawin yung intervention. So, for edema control naman, for edema control associated with inflammation, we make use of negative polarity. Tapos, ito yung parameters. Okay? Pulse frequency, 100 to 120 TPS or your hertz. Pulse duration is 40 to 100 microseconds. And then, continuously delivered ulit siya. And then, comfortable tingling sensation. And is applied 20 to 30 minutes. Okay? For edema control naman na meron siyang lack of muscle contraction. Okay? Lack of muscle contraction. We make use of biphasic or Russian protocol. Now, you can also make use of the IFC or interferential current if on-off time is available. So, dito wala tayong polarity. Walang negative, positive. Okay, and the pulse frequency we observe is 35 to 50 TPS. Now, with 2 to 5 seconds, equal ang kanilang on and off times. Okay, so ito may on and off na siya. And then with the pulse duration, 150 to 350 microseconds. So, duty cycle, on time 1 to 2 seconds, off time 1 to 2 seconds. No? So, 1:1 siya. Okay? So, on-off ratio of muscle pump mechanism. So, the amplitude here is up to visible contraction. Kailangan yung amplitude na isa-set nyo, dapat may makikita kayong visible contraction. And then, the treatment time would be 20 to 30 minutes. Ito, guys, this would be included in your pracs. Okay? Yung sa wound healing and then the edema control with inflammation, we cannot really apply this kasi wala kayo nung negative. No? Wala kayo nung negative. However, we might have to consider, kumbaga in real life situation, we cannot make use of this, unfortunately. Okay? Kasi wala tayong negative, positive electrode. Ito, since it is not polarity specific, this is included in your pracs. I'll release a guideline with our upcoming pracs. So, para alam natin kung ano yung gagawin. I'll decide on this whether to include this and then gawin na lang natin na sabihin nyo kung anong polarity or not at all. I will just announce it na lang. Okay? So, ayan po yung parameters. And then, electrode placement. This is associated with, if it's associated with inflammation, the negative polarity treatment electrodes should be placed directly over the area of edema. And then the dispersive electrode is placed over another large flat area proximal to the area of edema. Okay, so ibig sabihin, negative polarity ninyo, nandun siya sa edematous area. And then, medyo malayo ng konti yung dispersive electrode. Okay? Pag associated naman with lack of muscle contraction, electrodes should be placed on the muscle around the main veins. Okay? So, kailangan familiar pa rin kayo sa anatomy. Okay? For you to be able to place it at the main veins. So, main veins draining the area in the same way as recommended for muscle contraction. Okay? Yan siya. Electrical activity in the skin related to wounds and healing. Okay, so again, your fibroblastic activity, epidermal cell orientation, and migration have been demonstrated in direct current fields. Excuse me. For your antibacterial effect, no, kapag ito naman yung gusto ninyo, either positive or negative HVPC, kaya no, na promote ang antibacterial effect. Collagen content and increased wound tensile strength. No, we make use of direct current stimulation at 40 to 400 milliampere. Wound closure, no, if you want wound closure, both your alternating current and direct current, no, pwede siya for your wound closure. However, no, sa direct current, it shows most rapid reduction in the wound area, while your alternating current, most rapid reduction of the wound volume. So, most definitely, when we say direct current, no, it's good for wound contraction, for closing the wound. Okay? While your alternating current naman, most rapid reduction of wound volume, it's on the depth. No? Kung malalim yung sugat, no, it would be useful to make use of the alternating current. Okay? And then for tissue necrosis, of course, it's your direct current stimulation. Okay? So that would be the end of our part 1 ng lecture for today. Okay?